Hello, my name is Kimberly Ellis. I am also known as Kim E, the Diabetes MP. Welcome to More Than Lowering Blood Sugar, Protecting Your Heart in Type 2 Diabetes. This series is provided by CME Outfitters and is supported by an educational grant from Novo Nordisk Incorporated. Now, this is the third of 3 patient education webisodes. Today, we're going to talk about protecting your cardiovascular health and questions you may want to ask your own clinician. And again, I want to introduce myself. My name is Kimberly Ellis. I am a family nurse practitioner as well as a diabetes educator, and I am based out of Dallas, Texas. So I would like to start with a quick recap of just a few points that Dr. McGuire made in webisodes 1 and 2. And then we're going to have a treat. We're going to meet Drew, who is actually a patient with diabetes. Now, Drew and I have never met. We have not rehearsed. And so we're going to have our discussion on the spot. So you'll be learning about him as I'm learning about him as well. Specifically today, we're going to lean into the cardiovascular aspect of diabetes. We're going to focus more on your heart. Now, cardiovascular disease is the #1 cause of death in people living with diabetes. Now, as far as the risk of heart disease and stroke in patients with type 2 diabetes, about 7 in 10 individuals over the age of 65 will die of some type of heart disease. 1 in 6 will die of stroke. And for my ladies out there, women, we are 4 times more likely to have heart disease versus our male counterparts, which have just only a 2 times greater risk. Now, lastly, what I would like to also highlight is type 2 diabetes and cardiovascular disease actually share a lot of the same important risk factors. Risk factors are the different items that put you more at risk for developing a certain condition. And so they really have a lot of overlapping risk factors. Things like high cholesterol, high blood pressure, being overweight, tobacco use, or even secondhand smoke, having a family history, or being sedentary, like not exercising regularly or having long periods of sitting down. So I mention all of this not to scare you, because there is some good news, because the more that we know about this, the more that we can significantly reduce our risk. But many times we don't even know what our risk is and how we're more prone to being able to develop cardiovascular disease while having our diagnosis with type 2 diabetes. But first, let us go over to Drew. Let's meet Drew, a real patient with type 2 diabetes. So welcome, Drew. Thank you for being here today.
Thank you. Thank you for letting me be a part of this.
Yes. So what I would like to do today, I'm just going to ask you a few questions just to get to know you a little bit better and see if we can learn a little bit more about your diagnosis and then other things that are going on with your health. Is that okay?
Absolutely.
Okay. Now, first off, we know that you have diabetes. Can you tell me how long you have had the diagnosis?
Sure. Yeah. I'm 54, almost 55 now. I was diagnosed at 40 with it for the first time. Yeah. So, I was obese at the time, 5'10", 270 pounds nominally. So they obviously went on diet and medicines to, help control things. And, it did work. Although I just did what I was told, I didn't really know exactly what was going on other than do what I'm told.
Okay. Well, that's a good start. Well, let's back up a little bit. I want to ask, do you have a family history of diabetes or heart issues at all?
I do not.
Okay. So your mother, father, your siblings, no one, only one in the family that has diabetes?
Correct. I didn't treat my body well through
Okay.
my younger years in not in really in all the worst things that diabetes doesn't, handle well. Sugar, lots of
Mhm.
sugar. I didn't eat regularly. I get exercise. I have a lot of physical. I'm in construction, so I've done a lot of things physically, but I would pretty much only eat about through about a 4 hour period a day from 3 o'clock to 8 o'clock. And
Mhm.
from what it sounded like, with inundating drinks, sugars, juices, sodas, all the sweets, that I have a terrible just a terrible sweet tooth. And anytime I could, anything is sweet, I would like that.
Well, something I do, and I always like to tell people this, is it wasn't your fault. Okay. Like what you do is not, it's common to all of us, and I think that's a big misconception, not only to people who have the diagnosis, but people who are treating people with diagnosis and people who just deal with those with diabetes. It's no one's fault. Like, there are people who probably live far more unhealthier lives than you, a life than you, and they don't take a pill in sight. You know what I'm saying? It's just the luck of the draw. It just happens. So it's not your fault. So I want to correct you there.
Well, thank you.
Did you know prior to your diagnosis what your risk for developing diabetes was, and do you now know what your risk is when it comes to developing cardiovascular disease?
No and no. I did not know anything about diabetes. I'd heard about it, the word, but never had any clue that I was susceptible. Nobody in the
Mm.
family had it. And, my Greek relatives that I know, um, that they lived healthier lifestyles. And although they did develop heart disease, it was well into the 70s and 80s.
Mm.
And so was never diagnosed back to anything like diabetes. So unless it was missed.
Okay. And now, do you go to your primary care provider regularly?
I've had a rotation of primaries. That first primary that diagnosis retired, and I've now had to go through. There's probably, I don't know a lot about it, but um, I am with a new primary right now, and they are just gathering me together and asking all the questions. But they're just, I'm not getting I'm not getting information. I'm just, basically they just want me to, refill my medicines. I'm not
Okay.
getting told about, what this stuff can do to
Mhm.
me, or any, it's like you say, the cardiovascular. No, I have not been told.
And so at one point in time, diabetes was looked at just like a set aside diagnosis. It was all separate. Everything was separate. Diabetes, cholesterol, high blood pressure, stroke, they were all separate entities. We now know, we actually consider it now a cardiometabolic syndrome, meaning that it really involves your whole body, honestly. Diabetes is one of those dynamic diagnoses that it really can affect every area of your body, from your skin, your hair, to your teeth, to your eyes, all the way down to your neural system, which would be like your neurovascular and your cardiovascular. It can affect everything. And we now know that if we get ahead of it, we can prevent a lot of things, because a lot of these complications that you can develop, they're preventable. And so, what I would like to do, oh, before I do that, I do want to ask, just so I know, what medications are you currently on now?
A Torvastatin for
Okay.
I'm on Januvia,
Okay. Okay.
Metformin,
Alrighty.
and Levemir.
Okay. So you're on a long acting insulin as well. Okay.
Yes.
Okay. And do you take your medicines regularly?
No,
Okay.
I have not. I did for many, many years, and I am going through a little spell right now that I'm hoping that all you and all this education that I'm getting is going to help me get back to what I need to do. I think it's quite a coincidence that you've invited me to do this now. I'm going to try to use this as a motivation to do better.
Yes, yes.
Again, that
Well,
again that roller coaster. Again, there's a roller coaster. Yeah,
yes.
I've been feeling great. I'm 55 years old. I feel great, and I've been feeling great for years. And it
Mhm.
becomes tiresome, and
Yes.
it becomes, are you, do you really need to do it? You feel great.
Mhm.
You feel young. You feel wonderful, and
Yes.
but I think I'm probably, so no, I'm not, but I do plan on getting my act together. Probably just been a couple of months that I've been off, very regular.
Do you take your insulin regularly though?
I have not been, no, I have not been. And I have recently gone to the doctor and gotten blood work checked. I'm waiting for them to contact me, and they're going to probably scold me. And I'm going to be honest with them. And, you know, I'm motivated to, to get back on track. Like I said, I'm utilizing this whole encounter as education to,
Yeah.
to move forward in the proper direction. But it is a roller coaster.
Yes, yes. And I would say that, that's one thing that I tell people is that when you're dealing with any chronic disease, honestly, it's a journey. Sometimes you get out the car, sometimes you get back in, sometimes you drive forward, sometimes you just want to turn back around. And we have to have grace with ourselves with that. And also, when I educate other providers, letting them know that, like, we're not looking for perfection, because this is something that, even if your diagnosis goes into remission, you would still have to maintain the very things that put you in remission. So that would still mean taking your medicines regularly if that's what it called for. It would still mean your lifestyle modifications. You would still need to be mindful of what you eat. You would still need to be, active, consistently. And in the moment that you would stop doing that, then remission would stop. And so it is a journey, and having grace for yourself, also having very open conversations with your doctors and your care team to let them know, because there are different options that we're going to talk about a little bit here in a little bit, that could make your life a little bit easier, a little bit better for some people's schedules. It just depends. And of course, we're going to start back taking our medicines. We've decided that, right? And so you're already on some good medicines that are already heart protective. The fact that you are on a cholesterol medicine, that's a good heart medication. You don't have high blood pressure, correct? You're not on any blood pressure medicines, right?
Correct. Correct.
Yes. And so that'll be very good. You're on the first line medicines for diabetes, which is metformin. Are you having any issues with, like, any cramps in your legs at all? Anything like that?
No, I gotta say I haven't noticed any side effects yet.
Okay. And that's very good, because a couple of your medicines can cause that as well. And so typically, when it comes to medications, that cholesterol medicine that you're on, we call that a statin. We People are typically put on something like that. If they had blood pressure medicines, they would put someone on a medication for that. But there's a couple of classes that I do want to bring up to you that you could possibly, suggest to your doctor, because metformin is definitely a good medicine. Januvia it's a good one. It's not my favorite, but it's a good one. It's effective. But being that you want, it seems like you would want a boost to get back on track. There are a couple of drug classes that will help not only protect your heart and your kidneys, but also help you with weight loss as well. So let's talk a little bit about those. Okay. Now, the first drug class, I'm going to read off what it is, but I'm not going. It's we'll give you some information because you may not remember all the letters, but these are first called SGLT2 inhibitors, okay? And this first drug class, it is oral, and it does help with decreasing the stress on your heart and your kidneys. And it does help. The secondary benefits is weight loss, okay? Very effective medication, okay? The second one is what we call GLP-1 receptor agonist. Now, this medication, they do have one that's oral, but the majority of these medications are injectables, but you only inject yourself once a week. Okay. And so it's not insulin. Okay. I always have to tell people, just because you inject it doesn't mean that it's insulin. But this medication it's kind of like the wonder child. Everybody loves it. If you can get your hands on it, you want to get your hands on it. They just ended up putting out a new class in May that everybody's buzzing about, and people could easily drop lots of weight off this, paired with working out, not just working out, but just being active and eating well, taking this medication on top of the fact that you don't have to take it every single day. A lot of people like this medication, and again, it helps with lowering blood pressure, which you don't have, but you are a little bit at risk for that since you do have diabetes and cholesterol. I like to say those three conditions, they're not brothers and sisters, but they're cousins. They love to travel together. So it's like if you have one or two, you have a higher risk to get the third one. And so if you do start these medications, they probably most likely will adjust your other medications. I have seen people take folks off of Januvia because, again, like I said, you're on very common medications. And so a lot of times what happens, people come off of the Januvia and they may keep you on the GLP-1RA or the SGLT2 inhibitor and the metformin. And you may even be able to come off the insulin, and I've seen that for patients. I can't promise that, but it is something that, people love the medicines. And so we'll give you that information. The thing to think about with the first one, the SGLT2 inhibitor, you do need to stay very hydrated, okay? Which that is a recommendation, drinking enough water. We all need to increase our water, and a lot of people don't realize you really need to drink a minimum of half your weight in ounces. So let's say that you had a 200-pound person, they need to be drinking at least 100 ounces of water a day. And so you would want to stay hydrated with this medicine. It can cause dizziness or fainting spells. And then, of course, with this, but with this medicine, it can cause like urinary tract infections. So that's all the more reason, and yeast infections, all the more reason why you would need to increase your hydration with this so you can really flush yourself out and practice good hygiene to prevent those problems. And then with the GLP-1 RAs, the big thing to think about here with this one, with that injectable, it can slow how quickly your food leaves the gut. So it makes you feel full. That's what happens with this medicine. So you get full quickly, okay? But if you eat too much or too quickly, because it's not moving quickly out of your gut, you can make yourself feel nauseous. It's just like when you eat too much and your belly gets really full, that's what you'll feel. You'll start having some of those GI issues. And so if you feel that, that's kind of, when people first start that medicine, it's an adjustment. So a lot of times when people first start the medicine, they're still eating the way that they were eating, but the medicine won't allow that to happen. So they can kind of feel a little sick. And so that's normal. It'll go away once you start adjusting your eating habits, but definitely something to look out for that you would want to report to your clinician if there is any vomiting, And typically what will happen with this medication in general, they will start you on a slow dose to ease you into it so you won't have so much of that GI involvement. And then eventually it'll improve over time. And so any questions for me? I know we're giving you a whole bunch of information and we're going to give you some more. Any more? Anything that you want to ask?
So I like the idea of, maybe like you had talked about, talking about these medicines with my doctor, something that I could do once a week, something my schedule, people's schedule, like myself, it's a pretty busy schedule. So, if there's a way to mitigate all that, I'm definitely interested in, finding a way to do better.
Well, Drew, something that I do, because though I'm a family nurse practitioner, I do a lot of education in the community. And so I'm not always in the role as the person's primary care provider. And so I get people that are like, I feel like I can't talk to my doctor, I can't talk to my clinician or provider. And here's the thing, this is a partnership. Okay. You have to realize that we're all working together. There's not a dictatorship. There's not this authority that's over you. This is your care. And therefore, you drive the boat. We're just your guide. Okay. Now, and I also tell people, if you feel like you're entering into a space where you feel rushed, you don't have enough time to talk to people, then you can exit that place. There are plenty of providers out there that want to hear what you're coming from, and they're going to take that in consideration, because a very astute provider wants to hear what you're dealing with. They want to hear what's going on, because that's going to drive what care that they give you. Okay. It's no point of providing something for you that you're not going to even, you're not going to take, because that's a waste of both of our times. I want to see what's going on with you. I want to see what other, aspects, not just when it comes to your numbers in your medications, what's going on in your life. Like my question to you would have been like, did something happen in your life where you were so busy where you couldn't take your medicines? There are people here that can't afford medicines, but sometimes that question doesn't even come up because there's other options. But if you don't ask that question, how would you know? You see what I'm saying? If the provider doesn't ask that question. And sometimes people are not always forthright with telling them about stuff that's going on with their life. So you do need to be in a environment, in a relationship with your provider, where you can have these open conversations and there's a rapport there. And when you have that rapport there, then you can go into asking questions, and it doesn't feel like you're confronting them. You're really just having a conversation. You're really just having a conversation. And I personally don't get offended at all when people who ask me about stuff, because I am just one person. I'm one person. I don't know everything about everyone. And, you have all these patients and they're getting information from different places. I welcome that. If I don't have the answer, I'll say, hey, let me go and look that up for you, because of course I want the best for my patient. And so some of the questions that, just to kind of get your mind just kind of turning on some of the questions, so you can be more educated and you can create that dialogue with your provider, is really asking them, what is my cardiovascular risk because of diabetes? And there are free tools online where they can calculate it right there with you, where it can tell you, what your percentage is of developing cardiovascular disease. Again, the power is in the knowledge. If you know that, then you can do something about it now. You know what I'm saying? And that can be your motivation. We all love our lives and love our families and friends and what we have created. You want to be able to have a fighting chance. And so you do that by knowing what your risk is. Asking about how well controlled, your blood sugar is. What's your A1C? What's my goal? What's my target? Where would they want you to be? Again, everyone's different. So the goal has to be customized. You know what I'm saying?
Hey,
Also, oh, go
I was
ahead.
going
I'm
to say,
sorry.
yeah, you're saying you're right about everybody being different.
Mhm.
And so I can't speak for other people, but you have a tendency sometimes with a doctor to, I think you used the word, they're not an authoritarian, or they're not a dictatorship, but you go into that relationship, know that they know way more than you.
Mhm.
It's, you don't feel empowered to question them, and
Mhm.
nor do you really know how to gather the information to even know what question to ask.
Mhm.
And so it becomes very easy just to follow what they're doing and just trust that they're doing the right thing. You're probably right. Online, I could probably utilize online to gather more information and displace the doctor from that dictatorship position, and then just like you say, work as a team.
But here's the thing here, there's one thing that they don't know. They don't know your body better than you. Okay? They don't know what you're going through. And the only way that they can know that is if you're a part of the decision making. That's why we really come from a place called shared decision making, because they can't make the decision. It's not adequate if they're making it all by themselves, because there are things that they can only know because you tell them. And you have to I love the word being empowered. You don't have to know, you don't have to go to med school to say what's wrong with your body. Even just coming in and just being very open and honest, this is how I'm feeling. I'm overwhelmed by taking all these medicines, so I stopped. I always tell my patients, thank you for your honesty, because now we can get right to it. Like, that's how I feel. Like, I'm a straight shooter. And if people really want to save time, that's what they're going to want to do. You know what I'm saying? I want to save you time. I want to save me time, and everyone's happy. But having that shared decision making, you don't have to feel like you have to know all the medicines and stuff. We'll give you that information. You can just take that stuff in. You know what I'm saying? You can find out about that stuff, and you can suggest those things and ask, would this be good for me? And if not, why? And that's not questioning their authority. That's just trying to be, I just want to know everything. And you can say that. I'm not trying to question your authority. I believe that you know what you know, but I just want to know for myself so I can make educated decisions. And, I'm glad that we were able to talk about the one medication that's injectable, because I find that a lot of people don't know that, some people have a fear of needles, and that's okay. That's a different, different people. But some people would be more apt to take medications if they didn't have to take so many pills. And, just a little bit about me, my mother has diabetes, and that was something that she kept feeling just discouraged about, because she kept, every time she would complain about something, another pill would come, another pill would come. And no one even brought up to her that there was a medication that could be injected once a week. And my mom's like you, she's very active. She's on a go. She's like, I don't want to slow down and take all these pills and have to carry all this if I go out of town. If I just had this one little pen, I inject myself, that would give me better options. And then, you can, I think now that you have a lot of good things from what we've been talking about, you have a lot of things that you can already talk about. You can ask them. A discussion can happen over, you said it's been about 2 or 3 months since you've taken your medication. That's a discussion within itself, not like they're going to hammer me or they're going to chastise me. So you can ask, well, okay, well, what are the effects of that? Yes, my numbers went up, but has this increased? Do you believe this has increased my cardiovascular risk? Me taking insulin, do I have a risk for low blood sugar? Just asking questions just to be curious, and I feel like the astute provider would welcome that. I have plenty of colleagues have no problem. I'm one of those people. I have no problem. I want you to ask questions. So it's like, so that's why I always make that space for patients to be able to have this dialogue with me. So do you have any questions now before we hop off?
I'm sure I will, but right off the top of my head, nothing's coming to me right now. I'm going to, I want to gather the medicines that and then I'm going to research those and empower myself to talk to my doctor about those.
Very good. Very good. Now, to summarize all that we've been talking about, I'd like to play a short whiteboard animation.
There are an estimated 35 million Americans diagnosed with type 2 diabetes. If you have type 2 diabetes, chances are you take medications to manage blood sugar. But did you know that diabetes affects more than just your blood sugar? The fact is, People with diabetes have an increased risk of heart problems because diabetes can affect the inside of the blood vessels. Some of the most commonly prescribed diabetes medications that work well to lower blood sugar may not help prevent heart problems. The good news is that some medicines can lower blood sugar and reduce the risk of heart problems at the same time. Together with your healthcare team, you can take action to reduce your risk of heart problems. Track your blood pressure and cholesterol regularly. Be active through routine exercise. Choose a heart-healthy diet. Maintain a healthy weight or lose weight if needed. Don't smoke. Lower stress and get enough sleep. Talk to your doctor about medications that can help control your blood sugar with the added benefit of lowering your risk for heart problems. It's a heart-to-heart conversation with your doctor that can go a long way to keep you healthy. To find out more about type 2 diabetes and its relationship to the heart, visit www.cmeoutfitters.com/diabetes and cardiometabolic.
I hope you enjoyed that video. You can download a copy at the CME Outfitters Patient Hub. Now, lastly, I like to tell my patients about resources available online to support their diabetes care, including reducing their cardiovascular risk. The links on the screen represent just a few of my faves. And of course, my ultimate favorite is the one at the bottom, Kim E, the Diabetes NP YouTube channel, where I have created a playlist specifically for patients called the Patient Corner. And so again, thank you for participating in webisode 3 of our series. And if you haven't done already, please go back and check out the other webisodes 1 and 2 with Dr. Darren McGuire, an expert in diabetes cardiovascular disease at the University of Texas Southwestern Medical Center here in Dallas. Again, thank you and take care of yourself. Stay well.